Hello, everyone, and welcome to this episode of MSL Insights. Today, we're going to be discussing navigating the impact of COVID-19 to ensure a successful product launch through an effective utilization of medical affairs and MSLs. My name is Samuel Dyer, and I'm the chairman of the board for the Medical Science Liaison Society. And for those on the line that don't know, the MSL Society is a 501c3 nonprofit organization, and in fact, the only organization dedicated to advancing the global MSL profession by helping MSLs and managers become more effective in their careers. We accomplish this by offering numerous unique resources, including the first and only board certification for MSLs and MSL leaders. In simple terms, like any certification, the MSL certification is really an opportunity for MSLs and managers to validate their skills and knowledge of the MSL profession based on criteria determined by a large number of independent MSL and medical affairs leaders from some of the top pharmaceutical companies. If you want to learn more about the MSL certification, the URL is there on the screen. I'm also excited to share that we just recently opened up the 2020 MSL The Year Awards. This year, there's 8 categories, including MSL Rookie of the Year, MSL of the Year, MSL Manager Rookie of the Year, and MSL Manager of the Year, with each having a U.S. and outside the U.S. awards. This year, we also have 12 highly experienced MSL leaders that will be judging submissions. The awards are completely free to enter and to win, and you do not need to be a member of the MSL side to participate. So we'll send you a link to everyone after the show here, but their URL there on the screen. And then finally, I just wanted to share before we get started that the August 2020 issue of the MSL Journal has just been published today. I'm proud that we offered this free resource for the global MSL community, and this issue is focused primarily on this new reality of virtual MSL engagements. You can access the issue at the URL there on the screen, themsljournal.com. So, before we get started, I just want to go over a few quick technical details. As participants, you can hear us, but we cannot hear you. However, in your control panel, you'll notice that you have a question panel. We encourage you to type your comments or questions into the question panel throughout the discussion, and we'll try to address as many relevant questions as possible. We also have been asked by numerous people if this is going to be recorded. Yes, we are recording this show as well as all of our MSL Insights show, and they will be, all the shows and the recordings will be available on our website for everyone very soon. We just need a few days to put it all together. Lastly, I just want to thank H1 for sponsoring and partnering with us for today's show. So that brings us to our today's show, navigating the impact of COVID-19 to ensure a successful product launch through the effective utilization of medical affairs and MSLs. For today's show, we've had around 350 MSLs, managers, directors, VPs, and various other roles from 39 countries register. So it's clearly an important topic, and we know this based on numerous global surveys conducted by the MSL Society. There's a lot of concern regarding the effective utilization of MSLs during the current pandemic and what has changed as a result. So today, joining me is Dr. Ellen Shannon, who is the U.S. Head of Medical Affairs at Valneva, and Rob Consalvo, who is the Director of Strategic Commercial Engagement at H1. So thanks, Ellen and Rob, for being with me here today.
It's my pleasure, Samuel.
So I want to start our show today with both of you with sharing the results of one question from a recent survey that early results that we're conducting right now, the MSL Society. About 200 managers and MSLs, we asked the question, according to a global survey, prior to the COVID-19 pandemic, the median number of KOL relationships maintained by MSLs is 40. As a result of the pandemic, the number of KOLs should what? And here's the results. 11% said be increased, yet 44% of MSLs and managers said they should be decreased, and 46% said stay the same. So if you think about that, about 90% said either stay the same or be decreased. Ellen, I'm going to start with you. Are you surprised by those results, and what do you think about this?
Thank you, Samuel, for the question. And yes, I would say that I agree with, and I'm not surprised with the results. I would say there are a couple of pieces to this, though. For me, I think that it reasonably could be increased, and I know there's probably a collective groan from a lot of MSLs out there when I say that. Not a believer in a rigid number one, for how many KOL relationships that anybody should maintain. But I do also recognize that since COVID began, we've probably collectively all been at a travel standstill. So with that in mind, a lot of the previous time wasters and offline time with traveling, flying, being in cabs, etc., has gone away, and there is a lot more time that we can be in front of our computers, on webinars, on calls. So I think that there is time available, and I think it's a possibility that additional KOLs could be added to contact lists. I don't think it needs to be a mandate, but I think that it could actually be a time that we could start pursuing that.
Yeah, I think that's a great point. Rob, what is your reaction to this data?
Yeah, thanks, Samuel, and thanks for having me on as well. I'm not terribly surprised either, to be honest with you. I think Ellen, you made some really good points around sort of that increase and things like that as a potential area to look into. I think one of the things that we'll talk a lot about today is, some of those changes that we're seeing and how people are engaging with folks. I think with some of the use of newer technologies and a shift towards the digital, it's going to just change the landscape of what that engagement does look like. So in terms of like how you are effectively managing those relationships can change as well. And I think that there's not a reason why technology couldn't help to increase sort of that bandwidth, right, and make that possible.
Yeah. I think this is a really interesting question, and when I saw this data, certainly Ellen, I agree with you that this number could actually be increased. Now, there's a lot of concern on, you've got other, I guess, real issues at home with staying at home, and you've got family at home, and these other issues. But I think when I see this number and I see these results, I think the real opportunity for MSLs, when I think about the opportunity to increase the number of KOLs, what that says to me is that there's an opportunity to have a broader reach and a broader opportunity to add value to a greater number of KOLs. It doesn't mean, and I don't think it's realistic to think that, in previous survey we did several years ago, that the average engagement with MSLs and KOLs was 45 minutes. And I don't think that's realistic on a virtual, but I think the number of engagements are probably going to be less, and the amount of time is less, which means then there is an opportunity to have a broader impact. Ellen, is that what you were alluding to? I mean, would you agree with that?
Yeah, I'd absolutely agree with that. And I think the other piece to it is when we don't necessarily identify a strict number or a target number, I think people are, just MSLs, medical affairs in general, are more passionate about their jobs and about looking at sort of outside the box. Where else can I find additional contacts? And who else can I search for or connect with? So there might be some additional personal motivation when you have that extra time and you just want to keep reaching and striving for more people. I think the other thing I wanted to mention too is, I'm not saying that, if someone did increase their number, that this would be in terms of feasibility, once COVID is over, that they're not going to be able to maintain those relationships. I think, as Samuel just mentioned, there is a more efficient and I'll say quicker pattern here with KOL interactions with MSLs. So some of those being shorter. I think it may be that the frequency or the interval is less as well, or extended, so that we could accommodate maintenance of these relationships over time.
Yeah,
Yeah.
Ellen,
Yep.
I want to add on to that as well. I think that you're spot on there. One of the other things that could help to facilitate some of that maintenance long term are some of those more like passive types of engagement, right? So with the shift in how people are communicating and engaging with folks nowadays with the age of COVID, webinars and some of those more like passive streams of engagement can also help to sort of service that as well.
Yeah, absolutely. And we're getting a lot of response from the audience, and for anybody who has not been on one of these shows prior, one of the things that we like to do during the show is we certainly will take questions from the audience. I will read those questions out loud verbatim, and I will only use the first name of the individual. That way that person knows that that we have asked their question. And so we got several interesting responses to this, and I think this is a good place to start today. Ellen, here's one. Kelly has said, time available, ? Camps closed, kids at home, 200% unrealistic. And I guess it's a response to increasing the number of KOLs. But of course, we're not talking about, I think it's some of the issues we've talked about. What is your response to that?
Well, she makes a really good point as far as the adjustments we've all made to our lives, and working from home, unfortunately or fortunately, has always been a remote activity for medical science liaisons and medical affairs. So we are used to working remotely. The addition, as she brings up, of family and school and camps, et cetera, being absent during these times. This is true, but I would still challenge people. I think we've all been creative in terms of how we still attack the work or get the work done. And so sometimes that means that our timing, our hours on the job has flipped in terms of the shift per se that we're doing our work. Yes, this will create some scheduling logistics with KOLs and calls, but I think that we're still all working for our paychecks and on the clock. So we are finding ways to do that. I think that, this is still accomplishable. I'm not saying that everyone's having an easy time of it, but I think we can still constantly look for those opportunities and not use the circumstances of COVID to negate what we're trying to accomplish.
Yeah.
Yep. Rob, any thoughts on that?
Yeah, I think that the other thing to consider is, there are technologies that you can leverage for like asynchronous communication. So it's completely reasonable to try and build some of those engagement models in an asynchronous way, especially from the perspective of sharing thoughts and ideas, right? I think that COVID has represented such a huge challenge in a lot of ways. But similar to how we're engaging family and friends in unique ways now, and I personally send little short videos to my friends just with a quick little update, right? Or to my grandparents saying, hey, this is what's still going on in my world, right? I think that we can use a lot of those lessons that we're seeing from just our day-to-day life and our day-to-day interactions and how we're addressing this need as well.
Yep, absolutely. I think all great points, and it is tough for a lot of people. We just got to make adjustments, and I think again, this is where I think in a situation like this, where we have an opportunity to have even greater impact and adding value of MSLs by having a greater reach of MSLs. So I think her comment was well suited, but I think it's all about context. So thanks for sharing that. I have a discussion that point that I want you guys to kind of start with, and Ellen, I want you to launch us here. How has the COVID-19 pandemic impacted your initial launch plan? Because we're talking about, effective utilization of MSLs and things that may or may not have changed as a result. So let's start there today. How has the pandemic impacted your initial launch plan?
Well, so I think there's a couple of pieces here. The first initial impact, I think, that was felt probably globally was just this delay of everything. It was sort of a paralysis, if you want to use that word. For us, for the launch plans, we immediately delayed our clinical trials and studies that we were going to be starting imminently at the time. And some of that was just, I think, processing of all of the information that was coming in, all of the governmental, regional mandates for virus mitigation strategies and measures that were undertaken. And so a lot of it was just sort of how do we incorporate that within our own company and personally. That was the first COVID pandemic impact, I guess, that we felt. We all had to find PPE, incorporate that, provide that for our companies and our employees and colleagues. And then, of course, we had to think about, in this case, for launch and pre-launch, how is this going to affect the protocol, the subjects, the clinical trial sites? All of this sort of was the first piece that we felt in terms of pre-launch and launch planning. So with that initial delay, it was just this COVID immediate acknowledgement. Once those pieces were in place and we became sort of, I don't want to say the new normal, but a lot of these measures became integrated, it was more of looking at our Gantt charts. And for the Gantt chart world, thinking about how those initial delays are now causing a domino effect. For all of the other measures downstream, all of the other activities and pieces towards final launch of a new product. So this piece, we really, at that point, started looking at alternate solutions like concurrent activities that maybe previously had been sequential. Just to give you an idea of some of the things that we were dealing with from a launch perspective from medical affairs and MSLs. So those are, I would say, some of the initial things. And I would say at this point, we also looked at how we could accomplish some of these activities if they were going to be concurrent with the people that we had. And since we may not have obviously increased the FTEs prior to this, we looked at other people that could be cross-trained and brought in to help supplement our efforts to try to resume the launch plan as much as possible. So I'll leave that those examples first and turn it over back to you or to Rob.
Yeah, that's excellent. Rob, anything to add to that?
Yeah, I mean, I can just add a little bit of context from some of the folks that I talk to on a regular basis. I think, Ellen, you really touched on this towards the end there, but understanding those avenues for like cross-functional engagement has been, I think, really critical during this time. Making sure that, everyone is aware it's one team, right, that's working towards the end goal of improving wellness. So I think that's been fairly critical. I was curious more about some of those concurrent versus sequential pieces. If there was anything that you would be open to sharing a little bit more about, Ellen, but I understand if that's not in the cards for our time together right now.
I guess one of the examples, just to respond to that, would be, so for example, we were able to look at some of our colleagues that were in the commercial parts of the organization that were severely impacted because they were not going to be able to do customer-facing activities, sales, etc. And they were able to help us with bringing online some of the additional activities involved with launch planning and market analysis. Some of these things that we had placed later in the flow for launch planning, to bring those forward a little bit and have that additional help from those colleagues that could be redeployed or reassigned to these activities sooner. By bringing those forward, it shortened the timeline a little bit so that we wouldn't be as far behind from the original delays.
Mm-hmm. Yeah, and Ellen, Deborah has asked, please address is Valneva, and I think just wanting some clarification as our discussion continues here. Deborah's asked, please address is Valneva in current launch or planning for launch?
We're in planning for launch.
Good. Just wanted to clarify that came up. So excellent. Yeah, I think that these are some excellent points, and certainly, obviously, there's been a lot of need and adjustment as you kind of laid out there. Let me take this a little further, and again, I'm going to start with you, Ellen. What adjustments have you made related to the utilization of broader medical affairs, but maybe specific MSLs as a result of the pandemic?
Well, I think the biggest adjustment for me, and I'm sure there are other companies that can probably speak to this as well, is we actually went into a hiring freeze at the time of the pandemic. So where we had planned to have additional FTEs to help with the workload that was planned for the pre-launch activities, we ended up with no additional FTEs because of the hiring freeze. So doing more with less is probably a common thread right now, which resulted in, as Rob and Samuel, you and I had all mentioned about earlier, there was an increase in skill expansion. For those folks that we had in other departments or other platforms, we were able to reassign them as an adjustment to help our medical affairs department and our MSL department. Some of it was also increased training for others and for ourselves to take on some additional roles that MSLs and medical affairs had not been previously used to doing. There were a lot of differing departments, and as you can imagine, in different companies, sometimes it's siloed, sometimes it's not. So there was a lot of additional training that we adjusted and incorporated in order to try to be seamless with adding people to projects or completely redeploying them to a new responsibility. And I think also, in the absence of being able to bring on additional FTEs due to the hiring freeze, we were able to use some of our consultants in increased capacity. So they were able to supplement our teams to cover off on some of those gaps where we were expecting an additional or several additional persons to fill those holes.
Yeah, this is great. And let me ask a clarification question. Did these adjustments include finding broader opportunities for the MSLs and medical affairs to make an impact at the organization? So maybe broader responsibilities, and you mentioned cross-functional, but was there other projects that would be sort of categorized that way?
Yeah, some of the additional projects involved where we previously did not have medical affairs, or I should say the MSLs involved in maybe advisory board planning. Some of them expanded their skill sets in that regard. We're taking on roles they hadn't done previously with advisory boards. Additional things that were done were resource development or literature review that hadn't been part of what they specifically worked on before for the new project. Maybe they hadn't been assigned to it since it is pre-launch. So if they've been on a licensed product or a licensed project previously, that this was something new for them in terms of redeployment. And we also, I think, there's been some increased global interaction. So the communication flow has really increased in terms of adjustments with medical affairs and MSLs. We're finding that we are being pulled in and valued across the organization. And maybe that's been a really positive thing because of the increased visibility.
Yeah, this is excellent. Rob, what are you seeing with some of the companies that you guys are working with? I mean, what are some of the adjustments that have been made related to utilization of MSLs?
Yeah, it's a great question. Yeah, a lot of it is very similar to what Ellen described, right? We're seeing folks engaging their cross-functional peers that they might have previously not really worked that closely with on a day-to-day basis. And I think it comes down to a lot of the folks that we are working with are doing a lot of prep work, right? The old adage of like sharpening the axe to chop down the tree. I think what we're seeing across the board is that people are trying to find those elements that they typically didn't have also the bandwidth to accomplish when they were traveling so frequently, or they just didn't have the consolidated focus on them. So we're seeing people that are interested in looking at broader networks, right? So understanding some of those more like, I don't want, for lack of a better term, tier 2 type folks, figuring out how the engagements are actually working within an organization. And I think the biggest adjustment, though, Ellen, you said it really well. People are doing more with less, right? Their teams are either smaller or limited in terms of like their size right now. But what we're seeing is those people that are there are really expanding some of the things that they're comfortable with and you know what they're focusing on.
Yep. Yeah, I think these are excellent points. And Rob, I think we're getting a little bit of interference from your side. Just FYI, I don't know what if you could make any adjustments, but I don't know if everyone else is hearing that. But just in case everyone's hearing. Yeah, no problem. Just FYI, just I can hear a little bit. So this is great, and I think this lends itself to another obvious question here, and I'm going to go back to Ellen for you specifically at Valneva, and then we'll kind of bounce back over to Rob and for other companies. You think about these adjustments, and you've mentioned a few, but as other companies, other MSLs and managers that are on the line with us, what's worked? What has worked as it relates to these adjustments, and what's been really successful that maybe others can think about?
So there's a couple of things I would say that have worked since the pandemic. The first thing that I would say is that, and maybe some companies are not dealing with this right now, but I will just say that a huge, I'll say, factor that Valneva underwent was that while we saw some companies needing to downsize or looking at what they were doing with people that their particular role had come to a halt, Valneva decided actively that there would be, while we did go into a hiring freeze, all of the people that were at a halt or that their activities had come to a standstill were going to be redeployed or reassigned. And it was mainly to make sure that no one was going to lose their job or be laid off. That investment was so impactful to everyone within the organization. And I just feel like that spoke to everyone. The amount of productivity and commitment from people that had never worked in certain projects before or had never done certain activities, that really has worked. I mean, it has energized people, it has made them feel secure, it has given them additional skills they're proud of. There's been increased communication and sharing across platforms that hadn't happened before. So I feel like that investment in our people, even if it was not originally something that was purposefully planned, you know, prior to COVID, no one had expected this to happen. It just was serendipitous. We've just been very blessed in that way that this has, I'll say, happened for our company, that everyone has been proud to go on to their new assignment or to help with another team. I think going along with that, we've reinvented or shifted how we do our work. And so as Rob's been mentioning too, some of the computer applications that we've never used before are now constant applications that we use every day. So everything from Microsoft Teams to, I mean, everybody's pretty used to Skype and Zoom now, but these were not necessarily frequent before. It was more of an in-person emphasis. So shifting how we do things and allowing people across time zones and functions to participate and see all of the data, expanded access has really helped us. And I think the last point I just want to make is that I think we've reevaluated our old viewpoints and how we've approached things in the past and looked at it now to see how can we constantly improve. Say for MSLs, one of the things I think prior to COVID was a pretty traditional viewpoint of making appointments with your KOLs. A lot of times it was pretty standard to expect a 4-week lead time or maybe even longer for their schedule to accommodate us. We're finding now that these lead times are so much shorter. Within this week or next week, a lot of times that the KOLs can actually make time to have an online meeting or webinar or teleconference because of the way that the dynamics of COVID has changed everyone's lives. So we realize now there's a lot more access and we don't have to be rigid in terms of our thinking on how we do things.
Yep. And it certainly allows us to move things forward, you know, much quicker. So I think these are excellent points. Rob, what are you seeing? Any thoughts on this from the companies you're working with?
Yeah, absolutely. And Ellen, I want to touch on your last point, actually, the shorter lead time piece. What we're seeing is exactly what you just described, but also shorter meeting times, right? So I think you had mentioned this earlier as well, but during, you know, the interactions digitally, people are engaging for shorter durations, but they're more comfortable engaging more, either more frequently or setting up those times more quickly. We're seeing that too across all of the groups that we're working with. The other piece that we're seeing is that a lot of folks are having successes in building out those virtual engagements and on-demand pieces of content. And, you know, we talked a little bit so far today about how a lot of teams are sort of redistributing their efforts in that front. And this is something that we've seen a lot of folks seeing success in, and really it's around building that personal touch. Because when you're engaging with someone for a shorter amount of time, but you can, you know, get them on a little bit more quickly, you really want to have dialed in what you're going to be discussing with them and making sure that it's super relevant to them and all of those different pieces. So we've seen a lot of the teams that we're working with find a lot of success in building out those more focused types of engagements for those individuals, making sure that they're, you know, concise and tight.
Yeah, excellent, excellent. I think these are all great points. We're getting a lot of great questions from the audience, and thank you very much. Keep them coming. We're going to try to get through as many as we can. I'm just going to share a couple of comments more than questions, just to add to the dialogue here. Mancia has said, just a comment. Diversifying and recrafting MSL roles is a great way to demonstrate value, leverage MSL talents, and keep the team motivated. I think that's excellent. I agree. Would you both agree with that?
Definitely agree. That's well said. Thank you for that comment.
Yep.
Yeah, absolutely.
Barbara also has made a really good point. She says the number of KOLs that depending on the TA, I guess is dependent on the TA. We don't want to add for the sake of adding. I think we all agree with that as well. Would you both agree with that?
Yes, that's a very good point. Yeah, we're not trying to find additional contacts where there aren't any. Certainly, we have to evaluate the value of each person and what they bring to the organization.
I think the key is just intentionality, right? Especially when you're talking about engaging in this time. right? It's particularly important to just be very intentional about the people that you are adding, if you're adding any, or just the people you're engaging with in general, to make sure that it is a valuable interaction.
Yep, yep, absolutely. Here's a little longer statement here. And if I didn't capture this, the person who submitted this, Kylie, please clarify. So Kylie is saying, when thinking about launch metrics, some companies ask 90% in the first 90 days KOL engagement after launch versus lack of KOL availability. I think increasing the number may be detrimental to our perceived effectiveness during the launch and a pandemic. Ellen, any thoughts on that?
Well, I guess that portrays some of the differing opinions about specific numbers that different companies ascribe to. So I've never been one to ascribe to a specific number, but so I agree that this can be detrimental if we're trying to reach a certain number in a certain time frame. This pattern, again, it differs by therapeutic area, but 90 KOL contacts within the first 90 days seems, I'll say, aggressive. I would those 90 had been previously touched on or interacted with before the first 90 days after launch. So maybe this is just a reminder phase for those 90 people, and it's not a brand new interaction or relationship building.
Yeah, and it does to me as well. Seems a little bit metric heavy, and I think that part of that, if you're going to start talking about 90% reach in the first 90 days, I'm going to have a lot of questions about what is reach, what is relationship, what is contact. I mean, there's a lot of things. What's effective? I mean, let's have a long conversation around those types of things. But I think that there is, and as Ellen, I think you've alluded to, I think there's a balance here that we have to strike, because at the same time that we don't want to be just focused on metrics. I think Peter Drucker said it, this business leader from, I don't even know when he said this, in the 20s or something, but I'm a big advocate of, if you can't measure it, you can't manage it, right? So there has to be some level of that. But I think also the one thing that I always say to, especially new MSLs that we're training, the only constant in the pharmaceutical industry is change. And we're all experiencing that right now. So I think that has to be layered into that and have realistic expectations. Rob, it sounded like you had some comments to this as well.
No, I echo exactly what you just said there, Samuel. I think that there's a lot of things that need to be defined before you can actively say that 90 is 90 contacts in 90 days. It's aggressive, right? It seems there are a lot more things that need to be sort of distilled out there to really derive some value from that. Yeah, I'll leave it at that.
Yep.
I'm just going to make one other, if I can make one other comment on this. The 90% in 90 days, there's a lot of ways, and this is part of the reason I'm not a fan of a specific number. Everyone can chase a number. You can send out an email and copy 90 people and you're done, or whatever. So this is my point. Like, we're all striving for excellence, not just to strive for a specific number to achieve it and check it off. We're looking to see what kind of impact we can bring to the organization, what kind of value we can add. So yeah, that's 90% in 90 days is not something I'm a fan of.
Yeah, it's the 90% that we're talking about. Yeah. I think that's, it can be tough. So I have here's another question or a comment, I think, more than anything, and maybe we could just quickly respond to this, trying to get to as many as possible. Robert has said, don't forget that KOLs are being inundated with requests for remote meetings, and they are busier than ever between virtual and in-person visits. We cannot connect with them on demand. And I think that's a sound statement. I think that's true. And certainly this is where you have to have sound objectives, have to have a medical objective for reaching out. It needs to be a part of your medical strategy and a purpose. Ellen, any comments or thoughts in addition to that?
No, I would echo what you just said, Samuel. I mean, a tight agenda with the bullet points about what you intend to cover with the person, if there's any attachment or pre-read, etc., link. These are really essential to gaining the attention and the agreement for someone to meet with you. If they really feel it's a vague meeting or it's redundant, there hasn't been anything new for a product in ages, they're probably going to weed those out in terms of responding back or assigning a scheduled meeting time.
Yeah,
Yeah.
absolutely. Rob, any thoughts?
No, I think you're both spot on, right? I think that this is also where a lot of those technological innovations can really come into play, right? So they are busier than ever, right? But they're engaging content in different ways now, right? So it makes sense to help them engage that content where they live, right? Putting together some of those asynchronous materials, some of those things that are highly focused around those individuals as well, right? Like making the time to make sure that those elements, Ellen, like you said, are tight, right? That's going to be the way to sort of drive that and make that impression. Because at the end of the day, if it's not in that camp, if it doesn't sort of meet their needs off the get-go, they're probably not going to continue to make time after that.
Yep, excellent. We're getting close on time. I got 3 that I'd really like to get to. First one is from Christine. And Christine asked, any tips on how to build new relationships in a disease state during COVID, during a launch? Seems that KOLs have email and Zoom fatigue. Ellen, any quick tips on this?
I think that any materials, or as I was mentioning before, if you have a tight agenda, it's a new product, a new launch. If you have some links of the publications of anything that you can send to them in advance, it's going to catch their attention, and they'll be able to at least look at it and decide if that's something that they would want to pursue or talk about or clarify. Those kinds of efficiencies added to the agenda or to the email invite would really help.
Yep, I think that's excellent. Rob, any thoughts on other companies you're working with?
Yeah, well, I think Ellen, you're spot on, right? Like making sure that those materials are specific, but also I would say that leveraging networks becomes significantly more important as well from what we've seen. So not just like your formal networks, but more like your informal structures as well. So people that are within the same institution that may just have some sort of a loose connection to one another. Leveraging those when it's hard to set up some of those face-to-face pieces or any types of connections can just help to bridge that gap, right? And I think that that's something that could be explored a little bit more as well.
Yeah, I think these are excellent. Can I just add one more to this? I said I had 3 more, but we're getting so many good questions because we're talking about launch, and there's a lot of challenges in trying to build and engage and add value today. I'm going to add one more to this, which I think is very related to this. Shannon has asked, she has 2 questions, but we're just going to do the first one just because of the time, and I'm sorry, Shannon. But she asked, do you have any suggestions for newer MSLs in navigating the current situation with COVID? Many of us haven't had the chance to meet KOLs in our territories. And I think what she means is meet live. I think it goes along with the same thing you were talking about, but I just thought we'd add that one to this. Ellen, any thoughts on that?
Well, I think even before COVID, I noticed with some of the MSLs that I've managed over the years, sometimes the way that their actual email introductory statements were phrased and the information that they sent was eye-catching enough that this helped them gain the appointment and gain some time with the KOL. I agree it's so much easier if you can gain an in-person meeting and get to start that relationship. So I'm not discounting that. That is the ideal, and I don't know when we'll be able to return to that. Hopefully sooner rather than later, but I'm sure we have many months of this to navigate before we can go back to the in-persons. With that in mind, for the new folks, again, the more, I'll say, tight your email is with the specific information on it and the links of the latest data usually is appreciated by the KOLs. And they notice that and decide, that maybe in a more favorable way to give that person a chance for a meeting, even if it's a short meeting.
Yep, absolutely. Rob, any thoughts on this?
Yeah, Shannon, I think that's a great question. I think that typically what we're seeing across the board, and we're working with a lot of teams right now that are bringing on new MSLs fresh to the company, like brand new, never been MSLs before. One of the things that we tend to see and that we often suggest is working with your peers, right? There are people that have, everyone that's an MSL was starting as an MSL at some point. So working with those people to get a better feel for what worked even during non-COVID times can still tell you a little bit about how you can spend your time during COVID times. And I think, Ellen, you really hit the nail on the head, right? Doing your homework and knowing your audience and crafting your message to really hone in on that is what we've seen across the board as well. It's been critical for a lot of those new MSLs to ramp up as quickly as we're seeing them do.
Yep. Yeah. Look, and I just to add to what you both have said for both of these last few questions, but frankly, an overlay of this entire discussion. I mean, we're focused today on launch, but I think it's generally applicable to launch or continuing support of a product that has already been out. And for the people on the call and others who know me well, you probably have heard me say this a million times. The success of an MSL begins and ends at adding value to KOL relationships. And the COVID situation has not changed that. And so if you're going out and trying to build new relationships, your first job as an MSL is to uncover what that person values and then execute on it. And so part of that is going to be, as Ellen said, how you reach out, how you position it, making sure that you're educating people on what your role is and how it's different than other functions in a pharma company. So I think all of those things are really, really foundational important. Ellen, would you agree with that?
Yes, I totally agree with what you said, Samuel. Any of these aspects, just to customize as much as possible and do your homework ahead of time, they appreciate it. They realize that you have tuned into their needs, and that's really what it comes down to, that we can support them in any way they need, even if their research interests come across some totally different TA and therapeutic area than your own, but you just saw a brand new article in the latest journal of the latest article came out on their TA or their interest area in something else, you can send them that link just to show that you are looking at what they need and trying to be a go-to for them.
Yeah, I agree, Ellen. And I just want to add this too. I think that having that confidence that you can add that value too, especially as a new MSL, that's really important, right? And it's incumbent upon MSL managers, it's incumbent upon the organization to make sure that that person does feel comfortable and confident in that. But as an MSL, you should feel confident that your expertise will be valued by the people that you're going to engage, and that really does help to build that value, just Samuel, like you were saying. So I just think that it's important to keep in mind as well.
Yep, absolutely. I agree with both of your statements. All right, rapid fire. We've only got a few minutes left. I've got two things I want to get through, so we'll try to be succinct in all of our responses to these last two. Ellen, I'm going to start with you. what insights or recommendations can you share with other MSL teams who are dealing with similar challenges? So any insights or recommendations, just a few quick tips.
First thing I would say is look internally for additional assistance, as well as where you can offer additional assistance. Because again, we mentioned earlier about raising visibility of the value of the MSL team. If you feel that your team has some additional time or can be of assistance to other departments, now's the time to execute on that and offer it out. And in the same vein, it'll be increasing the skill sets of the MSLs.
Be a resource. Love that. Rob, other companies you're working with, any observations?
Just to echo it, building valuable customized education materials. I think that's the main thing that people can also access asynchronously.
Yep, absolutely. Yeah, this is excellent. And one comment that came in, John has said, need to be careful about proactively sending drug info and promoting. Proactive should be disease state only, so more difficult to send helpful information. That's true, but certainly you can proactively send information on the label, and of course always be compliant on all these things we're talking about. All right, so here's my last one that I'd like to have both of you address. It's kind of in that same vein, and Rob, I'm going to start with you on this one. Again, just based on what you've seen success at other companies, companies you guys are working with, this show is really about, we want to try to give practical advice and tips. And we kind of, in that same vein in the previous question, can you think of like one practical piece of advice or tip that you would recommend based on the topics we discussed today?
Yeah, I would say if you're going to try and get a better feel for how to engage the space right now in COVID, the most important thing is to get a feel for who those players are and what criteria makes them fit into sort of the space that they fit for your organization's strategy. So what we're seeing a lot of across the board is doing that strategic planning right now, and doing it in a way that's intentional to make sure that the pre-COVID and post-COVID world, that delta and what that looks like is taken into account. So that's my piece. Look at your tiering and look at your structure for your engagement.
Excellent. Ellen?
One last tidbit I would say is that although it is, I may have portrayed that it's really a strict business only approach and very tight agendas, let's always remain human and compassionate. And the first statements in your MSL emails should relate to how is the person doing and managing. And, you know, sometimes they'll just remember that you are human and compassionate to the situation they're in, and they'll remember that, how you treated them versus sticking strictly to the agenda kind of thing.
Yeah, I think lead with empathy, right?
Yeah, I think that ties into a conversation that you're hosting next week as well, Samuel.
Yeah, absolutely. It's a good setup. So, you know, look, I want to, as we're wrapping up time here, again, thanks H1 for sponsoring and supporting this event today. The next show, as we were just kind of alluding to, join us next week for MSL Insights, taking place next Friday, August 14th, 1 to 2 p.m. Eastern. We're actually going to talk about the importance of emotional intelligence for effective MSL KOL engagements. A registration link for the webinar will be sent out via email to everyone who's registered for today. And then also I want to mention, we also have a new webinar coming up. Difference between the Insights show and the webinar. Webinar, we're actually going to show slides and data. So it's a little different format. And so we work together with H1 to conduct a survey with KOLs to understand how the current COVID-19 pandemic is impacting the MSL KOL relationship. So we're going to discuss all the questions of the survey, and you see the information there. registration link will be sent for that as well for everybody who registered. So with that, I'm going to wrap up today's show. I want to thank again Ellen and Rob for being here. Thank all of you for being active. I know we didn't get to all of your questions, but thank you very much for submitting them. And we really hope that you found this valuable. As I mentioned, this will be an ongoing weekly show, and we have a brief survey. We'd like everyone to participate as soon as we end the webinar. So Rob, Ellen, thank you very much for the insights today.
Thank you.
Thank you as well. Yeah.
Thanks, everyone.